Chronic glaucoma is a chronic and often asymptomatic anterior optic neuropathy most frequently associated with ocular hypertension due to reduced aqueous humor outflow. Chronic glaucoma is often detected during a routine vision examination because it typically progresses silently and remains asymptomatic in its early stages, with symptoms that are subtle and difficult to notice. As the disease advances, some functional signs may appear, including headaches, blurred vision, and the perception of colored halos around light sources, especially in intense or artificial lighting. In later stages, visual impairment becomes more evident, characterized by progressive loss of the peripheral visual field and a decrease in visual acuity, reflecting more advanced damage to the optic nerve. During clinical examination, several physical signs may indicate chronic glaucoma. Intraocular pressure, IOP, is often elevated above 21 mm of mercury, although it may remain normal in some cases, referred to as normal tension glaucoma. Gonioscopy, which evaluates the iridocorneal angle, typically reveals an open angle without macroscopic abnormalities, helping to distinguish chronic glaucoma from angle closure glaucoma where the angle is obstructed. On fundus examination, the hallmark sign is glaucomatous cupping, characterized by a progressive enlargement of the optic disc cup visible on retinal assessment, reflecting glaucomatous optic neuropathy in which optic nerve fibers gradually deteriorate, often as a result of elevated intraocular pressure. Paraclinical examination in chronic glaucoma relies heavily on perimetry, a key test used to assess visual field alterations and an essential criterion for diagnosis. The disease typically presents with scotomas, which are areas of partial or complete vision loss within the visual field, with a characteristic pattern such as the Bjerrum arcuate scotoma that forms an arc in the peripheral visual field. In more advanced stages, these scotomas enlarge and multiply, leading to increasing peripheral vision loss and progressive constriction of the visual field, while the central vision is usually affected later and may remain preserved for a long time. Importantly, these visual field defects are irreversible, meaning that once vision is lost, it cannot be restored, which underscores the critical importance of early detection and screening to prevent significant visual impairment. Chronic glaucoma can present in several clinical forms, each with distinct characteristics and diagnostic challenges. In normal tension glaucoma, intraocular pressure remains within the normal range, below 21 mm of mercury. Yet optic nerve damage still occurs, often due to circulatory disturbances at the optic nerve head that impair blood perfusion, making diagnosis reliant on findings such as optic disc cupping and visual field defects. High myopia glaucoma is more difficult to diagnose because visual field and optic disc changes may be confused with those caused by myopia itself, complicating evaluation and follow-up. Juvenile glaucoma, which occurs before the age of 40, is typically hereditary and characterized by rapid and severe progression, often leading to more pronounced symptoms in young adults. Corticosteroid-induced glaucoma is a secondary form resulting from corticosteroid use, where ocular hypertension may improve after discontinuation of the drug, although this reversibility is not always consistent. Thanks for watching until the end, and don't forget to like and subscribe for more videos.